Joining me now with the latest on COVID-19 in our region is Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Good to be back.
Now, Doctor, a little concerning news. Since the last time we spoke, the Eastern Ontario Health Unit has added roughly 10 cases, including 2 in Cornwall, to its list.
Yes, and that is exactly the point that I keep making. That although it's a couple of cases and it's not an overload number, it still tells us that the potential of the COVID virus in any of the area that the Eastern Ontario Health Unit services is still there. So we've added cases. We've had 10 over the last week or so, and like 2 were in Cornwall, a couple were in SDNG, and a couple were Prescott Russell. So they're all over. And I would tell you that half of them were related to travel to Quebec or to Ottawa, or frequent visits to areas or contacts with people who already had COVID. So we know that. But that just, to me, really underscores the importance of being able to try to limit your travel as much as you can. Really make sure that we continue with the measures, the masking, the washing our hands, the socially distancing, and not going to work or school if you're sick. Those are the most important measures that we can take collectively to ensure that those numbers are low. Because if you look at our curve, we flatten the curve. It's not skyrocketing, but we're getting, like I said, an average over the last 10 days. Over the last week, 10 cases. So it's 1 or 2 a day, which is manageable. And when I say manageable, it means that we're able to contact that individual who's positive immediately, isolate that individual, get the history, who the person was in contact with, isolate them, test them if necessary, and so we can contain it. And that's what we're going to be doing all through the fall, all into the winter for sure, because this is the way that we'll contain it collectively, especially as we close. We're going into more closed. Winter's coming, fall's around the corner. We tend to get more viral infections anyway. So it's very important for us to continue with these measures moving forward. And again, making sure that we're able to trace them and keep an eye on the numbers. And if we do that and keep putting those little fires out, we should be able to continue the way we're doing. We're stage 3 now. Stage 3 and opening, what's ever open remains open. We don't want to go back. I have a good feeling about it, though, that I think that if we continue doing what we were doing, we'll be able to, chug on through. Again, life is not normal. This is our new normal until we have a vaccine, likely next year.
Absolutely, and when we talk about the 2 cases that were added to Cornwall, we know that the public is always concerned about how it was caught and things like that, and we know that the first case was related to travel to Europe, but there's nothing underhanded about that, nothing for people to be concerned about that someone was breaking the rules.
Not at all. The precautions were taken, and that's some people have to travel for whatever it is, and that's not an issue. The other case that we're looking at now, we don't have a cause for that. Or no, so that's again part of our investigation. Some of the other ones that we've had, like I said, were in contact with people who already had the virus or go a lot to Quebec or Ottawa, those type of things, because Ottawa still has, among the highest cases in Ontario now, if you look at the numbers over the last couple of days. So again, it really has to do with if you do have to travel, let's say you do have to go somewhere overseas for a family reason or whatever, those are extraneous circumstances. And we do know that sometimes people are abroad and then they're going to come back. Those individuals have to self-isolate, obviously, in quarantine. So there's nothing more to say about that. The issue is that individuals who are positive need to be tested, and the other message is that the virus can come back at any time. I think that's the most important, bottom line message.
And what always comes to mind, of course, too, when we talk about all this travel is the old sort of, I say old idiom, but from the beginning of this pandemic was the virus doesn't move if we don't.
Exactly. That's right. The more we move, the more the virus moves. The more we congregate together without physical distancing and masking, the more victims the virus has. The virus loves to go into bodies because that's how they grow. And the more bodies around, the more bodies that are moving, the more it'll spread and the more it'll infect people. It's very simple.
And for those viewers who go onto the Eastern Ontario Health Unit website, they'll probably notice a little bit of a new reporting model, a little bit more in-depth regional breakdown.
Yes, we've broken them down now to the municipality. So we've put the number of cases, total number of cases per municipality across the Eastern Ontario Health Unit area, Prescott Russell, SDNG, and Cornwall. And we've got the total numbers and the total number of active cases. And what I want to say as well is that most areas don't have any active cases, but that doesn't mean anything. Cornwall did not have any active cases 2 weeks ago, but now they've got a couple. And so it's very important to know that all of the municipalities have had cases. Some had more, some had less. If people will then see the ones that are closer to Ottawa, the Prescott Russell area had more cases. That's because a lot of people work in Ottawa and live in our area, in Rockland, Castlemaine, those are, the Prescott Russell area that's closer to Ottawa. But again, it's very important to note that, even if there's no active cases right now, tomorrow that may change. So we should not be complacent. Look over our shoulder, look over the river, look what's going on in the States, look what's going on worldwide. I think we're now at, if I'm not mistaken, we're at 24.5 million cases worldwide, close to, I got the numbers this morning, close to 6 million cases in the United States, right across the river from us. So it's important to know that we're still in a pandemic, but I also want to thank everybody out there for really adhering to these measures, because this is how we've kept it low. We don't have anybody hospitalized right now. We've had some deaths in long-term care facilities, but nothing outside of that. And so let's keep the good work going and make sure that we have a good entry into the school year, because the less that there is in the community, the less that's going to go into the school. And on a final note, Gabrielle, I want to remind parents, as they send the kids back to school, it's never too early to show your kids the importance of hand washing, not touching your face, and if where appropriate, how to wear a mask and how to take it off safely.
Absolutely. All of those things certainly start at home. On that note, Doctor, thank you so much for joining me for this update.
No problem.